One of the ways that we can look at function around the first met head itself, the hallux, is to do a test called the Hubschers Test, predominantly a weight-bearing test. And what we're looking at from the skeleton model point of view is we're looking at what happens to the foot if we have a restriction in that first met. So as we're trying to advance forward, if we have a blockage through the hallux, what we tend to find is that the midfoot will displace medially and in a plantar direction, so we'll acquire a sort of a pronation profile. Following from the rest of our structural profiling with our bio-advanced tests, we go down to the first MPJ and we're looking at the weight-bearing closed chain dorsiflexion range. It's a test called the Hubschers Test or the Jack's test. Quite a useful thing to look at. It gives you a lot more information about the first MPJ and as to whether there's a working relationship between the joint and the rest of the foot and ankle. What we should be seeing is as we grasp hold of the hallux itself, so we're grasping underneath the IPJ, as we try to dorsiflex the hallux, we should see a compensatory shift through the rear foot complex, medial column and tibia, so we should see a compensatory external rotation at tibial level. So if we come back down into the toe itself, we grasp, we elevate, and we see how much change that we can induce at that level. So when we look at the clinical test in a weight-bearing environment, we're looking almost at a retrograde response where we're grasping the hallux, we're trying to dorsiflex that, and we're seeing if the midfoot itself reconstitutes or the arch comes back, if you like. So a positive test will be that the arch does come back.